Now we will see the symptoms of hypertension. Hypertension is called the silent killer because it is often asymptomatic until it becomes severe and target organ disease occurs. Most people don't know they have high BP because they aren't obvious symptoms. That is why it is important to get the BP checked regularly. A patient with severe hypertension may have a variety of symptoms, from the effects on blood vessels in the various organs and tissues or to the increased workload of the heart. People with very high BP can experience symptoms include fatigue, severe headaches, chest pain, dizziness, difficulty breathing, nausea, vomiting, blurred vision or other vision changes, anxiety, confusion, buzzing in ears, nosebleeds, palpitations, abnormal heart rhythm. Physical examination may reveal no abnormality other than high blood pressure, changes in the retinas with hemorrhages, exudates, narrow arterioles, and cotton wool spots, and papilledema may be seen in severe hypertension. If hypertension isn't treated, it can cause other health conditions like kidney disease, heart disease, and stroke. Although individuals can measure their own blood pressure using automated devices, an evaluation by a healthcare professional is important for assessment of risk and associated conditions. How to check the blood pressure? The blood pressure is usually measured using a blood pressure monitor. This is usually an electronic monitor connected to an inflatable cuff which is wrapped around the upper arm. A sphygmomanometer, also known as a blood pressure monitor or blood pressure gauge, is a device used to measure blood pressure, composed of an inflatable cuff to collapse and then release the artery under the cuff in a controlled manner, and a mercury or an aneroid manometer to measure the pressure. Manual sphygmomanometers are used with a stethoscope when used in the auscultatory technique. The blood pressure reading is written as two numbers. First is when the pressure is at its highest, that is systolic pressure, and the second at its lowest, that is diastolic pressure. For example, the reading might be something like 140 by 90 mmHg. Reading at home using a 24-hour monitor that checks the blood pressure throughout the day is called ambulatory blood pressure monitoring or ABPM. Readings at home using the own blood pressure monitor is called home blood pressure monitoring or HBPM. In some cases, the GP might want to run other tests as well. For instance, they might want to do the blood test to check the cholesterol level and kidney function, or check the heart rhythm with a test called an electrocardiogram. Now we will see the management and treatment of hypertension. High blood pressure treatment include lifestyle changes and medications. Treatment is based on the blood pressure readings, the cause of the high blood pressure, and the underlying conditions. Lifestyle changes to lower the blood pressure. In some cases, it's possible to lower the blood pressure without medication. For example, the provider may recommend starting the lifestyle changes if a person has elevated blood pressure or stage 1 hypertension. Here are some proven ways to lower the blood pressure naturally. Person must keep a healthy weight, eat a healthy diet. An example is the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. The DASH diet helps people lower salt, which contains sodium. The diet is also rich in nutrients that help lower the blood pressure. These include potassium, calcium, magnesium, protein, and fiber. Vegetables, fruits, and whole grains are the basis of the DASH diet, but it also includes foods that are good sources of calcium, protein, and other nutrients. This diet includes fat-free or low-fat dairy products, fish and poultry, which have generally low levels of saturated fats, beans, and nuts. This DASH diet limits the following foods: fatty meats such as beef, pork, and lamb, full-fat dairy products, tropical oils, sweets, and sugar-sweetened drinks. This DASH diet helps lower the blood pressure. Person should cut down on salt. Person should get enough potassium. Try to consume 3,500 to 5,000 milligrams per day. Some foods high in potassium include bananas, avocados, and potatoes with skin. Exercise also helps lower the blood pressure. Limit alcohol drink. Typically, non-pharmacological techniques are implemented for about 1 to 3 months while monitoring the patient's blood pressure, and then, if not controlled, medications are started. Medications to lower the blood pressure. If the client has cardiovascular disease, diabetes, chronic kidney disease, high risk for cardiovascular disease, the goal is to reduce the blood pressure less than 130/80. For most people, the goal is to have a blood pressure less than 140/80. Four classes of blood pressure medications are first line. Most effective and commonly prescribed medications when starting treatment are first diuretics. Diuretics flush excess sodium from the body, reducing the amount of fluid in the blood. People often take diuretics with other high blood pressure medicines, sometimes in one combined pill. Thiazide diuretics, including hydrochlorothiazide and chlorthalidone, eliminate extra water and sodium from the body, lowering blood pressure. Not to be given in renal failure patients. Watch blood urea nitrogen and creatinine levels. Watch patients who are taking lithium because of increased chances of lithium toxicity. Next is angiotensin converting enzyme inhibitors. It blocks the production of angiotensin II hormone, which the body naturally uses to manage blood pressure. When the medicine blocks angiotensin II, the blood vessels don't narrow and prevent vasoconstriction. ACE inhibitors, including enalapril and lisinopril, relax blood vessels and prevent kidney damage. This drug causes potassium retention, so avoid potassium substitutes or supplement. Patient may have dry cough, taste changes. Next is angiotensin receptor blockage. It includes losartan and telmisartan. It relaxes blood vessels and prevents kidney damage. It may be prescribed in place of ACE inhibitors if patient can't tolerate ACE inhibitor. It works by causing vasodilation by blocking aldosterone and angiotensin. Next drug is CCB, calcium channel blockage. It includes amlodipine, felodipine, cardizem, verapamil. Calcium channel blockage prevent calcium from entering the muscle cells of the heart and blood vessels, allowing these vessels to relax. It slows the heart rate to decrease the workload on the heart and cause vasodilation, which lowers the blood pressure. Next drug is beta blockage. Example is labetalol, metoprolol. Beta blockers are medicines that lower blood pressure. They also may be called beta adrenergic blocking agents. These medicines block the effects of the hormone epinephrine, also known as adrenaline. Beta blockers cause the heart to beat more slowly and with less force. This lowers blood pressure. Beta blockers also help widen veins and arteries to improve blood flow. Now we will see the prevention of hypertension. Fortunately, there are things a person can do to reduce the risk of developing hypertension. These include follow a healthy eating plan. This is an important step in keeping the blood pressure normal. The DASH diet, the DASH stands for Dietary Approaches to Stop Hypertension. To prevent hypertension, reduce the amount of sodium in the diet. Losing excess weight with diet and exercise will help lower the blood pressure to healthier levels. Even simple physical activities such as walking can lower the BP. Drink alcohol in moderation. Lifestyle changes can help lower high blood pressure and can help anyone with hypertension. Many complications of uncontrolled hypertension. Among other complications, hypertension can cause serious damage to the heart. Excessive pressure can harden arteries, decreasing the flow of blood and oxygen to the heart. This elevated blood pressure and reduced blood flow can cause chest pain, also called angina. It can cause heart attack, which occurs when the blood supply to the heart is blocked and heart muscle cells die from lack of oxygen. The longer the blood flow is blocked, the greater the damage of the heart. It may cause heart failure, which occurs when the heart cannot pump enough blood and oxygen to other vital body organs. It can cause irregular heartbeat, which can lead to a sudden death. Hypertension can also burst or block arteries that supply blood and oxygen to the brain, causing a stroke. In addition, hypertension can cause kidney damage, leading to kidney failure, complications during pregnancy, eye damage, and vascular dementia.